Okay, so I'm going to have to do this in 2 sessions because it only gives me 3 minutes to do this. So the first one is gastric ulcer with massive upper gastrointestinal bleeding. 58-year-old female. Gastric ulcer with massive upper gastrointestinal bleeding. A 58-year-old female was rushed into the emergency department following 3 bouts of hematemesis and a single bout of melena. On examination, she was tachycardic, hypertensive at 121 beats per minute and 90 over 50 mmHg, respectively. She manifests pallor with no enteritis. She's epinec and normothermic, but reports intermittent periumbilical tenderness. Medication history reveals occasional intake of non-steroidal anti-inflammatory drug, naproxen 250 milligrams for arthritis management. On admission, her complete blood count revealed a hemoglobin level of 5.1 GDL, hematocrit of 32%, prolonged prothrombin time, and a positive uriatric test. All other laboratory studies were within normal limits. Based on the clinical presentation, intravenous fluids were administered and 3 bags of packed red blood cells were transfused. And gastroenteritis was consulted, and an upper gastroenterologist was consulted, and an upper gastrointestinal endoscopy was performed, which revealed a 1 centimeter hemorrhagic gastric ulcer. The bleeding was cateterized, and biopsies were taken for Helicobacter pylori, the results of which are negative. Proton pump inhibitors were started. She was discharged after 2 days in stable conditions. Uncontrolled non-insulin dependent diabetes mellitus. 58-year-old female with non-insulin dependent diabetes mellitus was seen in her primary care provider's office. Reports of diminished sensation of both feet and occasional blurred vision. The client admits to problems adhering to her prescribed dietary and medication regimen. She doesn't exercise regularly, takes her medication only when she is reminded, doesn't watch her diet. She denies dyspnea, polyphagia, polydipsia, polyuria, and diaphoresis. The client had a history of non-insulin dependent diabetes mellitus for 15 years and dyslipidemia, hypertension for 8 years. She has laser photogenic for retinopathy.